name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri, and this is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. Welcome back to our channel. We're so happy you joined us. Today is a really interesting topic. If you have not subscribed, please do so. We upload 2 videos a week all about integrative medicine topics. We always love when you give us comments. That gives us our content for future videos. So always comment below what you'd like to hear about, questions you have. We're loving all the questions. Hit the like button, we appreciate it, and always hit that little notification bell at the bottom so we know you know when we've uploaded our next video. Today is an interesting topic.
Today we're going to talk about ketamine and esketamine and its use in chronic pain management and refractory depression. But first, I want to wish all of our veterans a happy Veterans Day. A particular shout out to my 2 friends, Dr. Raymond Schmidt and Dr. Robin Misich, and John Stafford, who served in the Vietnam War. The reason I'm doing this talk is because in the past we've covered chronic depression and in our other integrative medicine videos, and we've even covered chronic pain, but I'm talking about something, a particular drug that's now hitting the news a little bit because last year esketamine, which is a molecule similar to ketamine, hit the market, and it's delivered as a nasal spray, and it's used for people with treatment-resistant depression. Now, this is going to be the topic of this talk today. I'm not going to be talking about regular depression, which we have covered in the past, and for people who've used medications and integrative techniques are doing okay with that. This is really focused on individuals who have really severe depression and to the point where they are considering electroconvulsive therapy, or even they're either not there or thinking about it. This is an alternative treatment. Now, just to give you a little bit of background, the brain we have 2 major molecules that are important for the transmission of activity in the brain. That's called GABA and glutamate, and they form the spark and the stop of the brain activity. And ketamine has been shown to actually help repair some of the damage of the neurons in the brain, and has actually put together or reestablish connections in the brain, especially those people with depression. Now, again, ketamine has been used since the 1960s as an anesthetic, and I used it a lot when I was in my training and during my practice. And most recently it was used, if you recall, there in the news there was this sports team that was in Thailand that was trapped underwater in a cave, and they had to get, these were young boys, and in order to get them out of the cave, the technique that they use is using ketamine to help calm them down and give them a slight sedative effect. And it works very well, especially for kids, because it does not depress the respiratory rate. And it's long been used as an it's FDA approved for an anesthetic, and it has a very safe profile if you know how to use it. But it also has been shown to actually be very effective in treating what is called treatment-resistant depression, and that's been in the literature since 2010. So there's been many years where that's been described in its use. And when you use it for depression, you really used basically 1/10 of the dose we would normally use for anesthetic purposes. So it's really a small dose, and has been shown to help with depression, but also with anxiety, PTSD, and chronic pain such as fibromyalgia, and what we call neuropathic pains that are really coming from the damaged nerves. So it has a wide variety of uses.
Is it always IV, or can it be
Well,
pills?
no, it can be as an intramuscular injection or intranasal.
But it's not a pill.
Nope. And IV is the other form that we talked about. In 2018, some Yale researchers were looking at the activity in the brain when they gave ketamine to depressed individuals, and they found that it was actually repairing some of the connections that had been lost. And this is what happens with people in depression. The theory is that you lose some of these connections, and ketamine helped establish some of these connections. So it's very interesting. And esketamine is a variant of the molecule of ketamine itself, so it functions very similar to it. Now, you may ask, well, why didn't they do this with ketamine? Well, ketamine has been off patent for many years, And so nobody's going to do research on this unless they can monetize it. Esketamine, since it was a different molecule from ketamine, or slightly different molecule, it was different enough that they could actually patent that particular drug and put into a nasal spray. So FDA approval is actually very important, especially if those individuals who are considering using nasal esketamine, and it's very important for insurance reimbursement. However, it doesn't guarantee that it's going to be covered. And I looked around the internet and I was trying to find what the cost would be for the nasal esketamine right now, and what I could find was that for 56 milligram dose, you would have to pay $590 up to $885 for the 84 milligram dose. So it's not cheap. And so different insurance companies require you to go through many different steps before they'll actually approve the use of it. Now, when we give IV ketamine, let's say for chronic pain or even depression, it has to be given at a very slow rate, between 40 minutes to an hour. And there are some side effects, and they have to be handled throughout the course of the infusion.
I have a question. Is ketamine only used in humans?
No, it's actually used in animals too. In fact, in our industry, we joke about it and we call it ketamine. They give it oftentimes for sedation. Yep.
Oh.
Yep. So some people call it ketamine because we use it very often for kids as well.
Oh.
Yeah, but it's a very safe in the fact that it does not suppress respiratory rate, which is our biggest concern, but does provide the kids sedation.
Off the subject, you know how you try to round up all your kids in the car? It's like rounding up kittens, and ketamine.
The nasal esketamine that's been FDA approved has to be done at certified centers and have been approved by the FDA per the FDA regulations. And the reason for this is really to prevent any abuse of the drug itself, because it can be hallucinogen. I do need to state this right off the bat. Ketamine is called a phencyclidine derivative, and it's very similar to LSD in the effects. So in higher doses, it can give you the hallucinations. Even some of the lower doses that we use for pain management and for even depression, some people may actually experience those hallucinations.
I'm someone that has this type of untreatable depression, and I'm thinking I'll be okay with the hallucinogenic effects because my depression is so recalcitrant to any kind of treatment. How do I get it?
Well, per FDA regulations, it has to be given through a pre-approved care facility. And you can go on the company's website. It's called Spravato is the name of the drug. And if you type in that name, and we're going to put this up in a link, to type in and go in and see which care providers are available that can actually administer this medication. But again, it's got to be done at a care facility. You have to have be under the you have to be monitored when you provide it. And it's just like IV ketamine. You really should have someone drive you home. It's got to be monitored and given over a short period of time, especially if it's IV ketamine. And there are some side effects. They include dizziness, decreased sensitivity. Some people do experience some hallucinations. Some individuals do become very anxious during the administration, or even nauseous, and those can be handled easily by a trained professional. The success rate for IV ketamine for treatment-resistant depression is between 70 to 80%. And as I mentioned earlier, the thing that made everyone excited about esketamine in the Yale studies was that they were getting almost similar type of results. So it quickly got passed through the FDA as an approved medication for treatment-resistant depression. Now, word of caution, when you look at the two drugs, which one do you pick, IV ketamine or the nasal spray? Just remember that you're going to have individuals and physicians who have differing opinions. IV ketamine has been on the market for depression for maybe 9 or 10 years, and it's got a lot of real-world results that you can look at. The nasal spray esketamine has not been around as long. The preliminary studies were favorable enough that the FDA gave it approval, so just bear that in mind. I don't know for sure whether it's going to bear out in the long term. The other thing to be cautious about as well is that nobody really knows what the effects are of giving someone long-term IV ketamine or esketamine. And right now, everything seems to be relatively safe if you do it in a very short period of time in a controlled fashion. The most interesting thing about ketamine, it is very different from any of the other antidepressants that are out on the market. Works completely different in terms of how it affects the neurotransmitters in the brain. It actually seems to reconnect those nerve pathways that were broken with chronic depression. Just to recap again, IV ketamine used for treatment-resistant depression really is for only individuals that have tried almost everything. And we have an earlier video where we talk about integrative medicine and conventional medicine together to be used for people with depression. IV ketamine is really used for a very select group of individuals. I use it myself in my own clinic for people with chronic pain. And going back to Dr. Sue's question about where we can get it, you're going to almost have to search around because it's not easy to find. In your area, you can type in IV ketamine clinics and actually come up with a few individuals that'll come up in your area that do it. We do it here in our clinic for pain as well. The other thing I have to caution you about as well, insurance companies are, as a rule, do not cover this very often. So expect in many clinics to be paying cash for this, and they vary. The prices vary. That's it for today. Thank you for joining us. I hope you found this useful. In 2 weeks, we're going to be doing
menopause, but our midweek check-in this week is going to be regarding vaginal dryness and treatment options for it. So hopefully you join us for those two. So we'll see you again between Tuesday and Wednesday for a subject called vaginal dryness and some integrative medicine treatment options for it. And in 2 weeks, we'll cover menopause.
That's all for now. Thank you, everybody, for joining us. Bye-bye. My wife. This is the fourth take.
Okay.
Okay, ready? You're not ready. I can tell by your lips. They're pursed in a funny way. And they're ready. Okay, get it out of your system. Go ahead. Okay, ready?